I currently hold a certification, okay, with the NHA, and working in the field. Not certification exam was, my certification was an ICD-9. Yeah. If you're going to go with AHIMA, you know, you can stair step up, but you know, I've never, I don't want to sound critical, but I've not heard anybody get a job as a CCA. I think if you even think you can do it, just get the CCS through AHIMA. Don't mess around with the CCA. And again, take a mock exam. And if you do well with it, you're already working in the coding. If your certification was an ICD-9, that's great, but there's still CPT in there, and you need to be familiar with that. Now, if you're going with the AAPC and you're going to get the CPC, you really need to know your CPT. If you're going to get a CPC, you need to know your CPT, because physician-based is done on CPT for reimbursement, so it's heavy in that. How is this going to affect home health care? Well, it's interesting that you say that. I worked in home health for a while, and there are going to be some changes, but I can't tell you what they're going to be. It's really interesting. I haven't done that for over five years now, or 6 maybe. I can't remember how long it's been. And you know, it's all based on Medicare with them, pretty much. Now, I didn't do children. Will there be a boot camp in Delaware, Philadelphia? Yes. It's I think it's already scheduled in Philadelphia. So if I don't know the dates, she tells me, and if these dates are okay, I say yes. And so I don't know, but you can just go to the help desk at codingcertification.org, and Sylvia will let you know.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.